Few scenarios we can accept as it is. There are many scenarios we can accept even data is not as per protocol. Why? Because there are some logics that we can accept the scenarios. So what are those? One scenario means, for example, systolic blood pressure and diastolic blood pressure should be normal range per protocol 120 by 90. But in database site is recorded 80 by 130 or 90 by 140 or 60 by 90, something like this. The data is deviating the protocol. Site responded data is correct as is. So in this scenario, if protocol is saying something else but site is saying correct as is, in this scenario we can accept as it is. Why? Because we cannot change this data even though protocol is not accepting. We can accept some ranges after discussing with the sponsor. This is one simple example. And one more example, for few scenarios time is not reconcilable. If you go to lab reconciliation, date we are reconciling or something sample is we are reconciling, visit is we can see, but time somewhere we can accept as it is. Suppose drug is given, drug should be given per protocol 10 p.m. but subject took 9 p.m. only or 11 p.m. In this scenario we will query but site is responding correct as is. So we have to accept this issue as acceptable as issue, because even though if you query also this time is not changeable, but there should be a documentation and there should be a discussion with the sponsor. The investigator may be signed and looked into the issue. So this is also one kind of acceptable issue. So like this, there are many scenarios you will see in the clinical data management. Some visit data, suppose visit 6 data may be entered in the visit 2, visit 2 data entered in the unscheduled visit. Like this, there are many scenarios we can accept as is. These are called acceptable issues. So while working in your trial, you can see these kind of scenarios so that easy for you to learn the work in the clinical data management studies. I hope these are helping you. I'm sharing you many topics. If this is helping, please comment below so that I can do it more videos for you. Thank you so much for listening. See you in next video. Bye.